So Shirley, this is a telehealth, the screen. This actually logs into remote hospitals, little community hospitals, Beechworth, Yarrawonga, Bright. And the intention of this is you've got patients who come there in the middle of the night and the GP doesn't really need to be rung about them, and it's the sort of patient you can treat via this video link. The guy with recurrent back pain who needs some narcotics for his pain, that's fine. If you've got an old bloke with first presentation of back pain, that's not going to be fine. You're not going to be sure what's going on and he'll need to come down. So you want to make sure it's safe for the patient, safe for yourself. You can imagine a kid who's had some vomiting and some diarrhoea and they just need some ondansetron wafers, some fluids. You review them in an hour and they're fine. They can go home and be reviewed by the GP in the morning. They're the sort of patients we're looking at treating. So what you're going to see on the screen is Beechworth. In a sec you're going to put your headphones on. Just be aware, telehealth, you've got a really experienced nurse who's actually your brain and your hands on the site.
Terry, we haven't got a doctor on call tonight, so I'll put you on the telehealth program where you talk to the doctor on the camera.
She's done all this before. She's actually worked out this patient's suitable for telehealth. She's going to be doing the treatment with the patient. She'll be interacting with the patient.
Good evening, Doctor. I'm Debbie, from the registered nurse from Beechworth. Doctor, I'd like to introduce Terry to you. Terry's presented tonight with an acute exacerbation of neck pain.
So your plan, yes, it's to you're going to talk to the patient, and the treatment plan is going to be run by the patient, but a lot of the work is also happening with the nurse.
Okay. And Deb, is it possible to
move him as well? So that involves sitting him up and doing some neurological examinations and stuff.
She's experienced and she'll be doing the work, so make sure you talk to her about the plan.
I'll just get you into the legs over.
She knows what's going on. She knows her community far better than you do, and they're all experienced doing this.
So can you raise your arm up like this?
I can see where the range of motion and how much is limited.
Well, it stops there.
And again, in that setting of trauma and your limited movement and that increasing quite severe shoulder pain.
Look, the patients you're treating with telehealth, you need to know it's safe to treat. There are some patients who say, I don't feel safe with this, they need to come down. You don't have to treat everyone by telehealth.
And I really do think an x-ray, some imaging would be warranted for this situation. So I would really like to bring Terry up to Wangaratta
and do all those examinations and investigations myself.
So, Doctor, did you want to do that tonight, or did you want us to organise that in the daylight hours?
I think this is something that can wait.
Okay.
It's quite late at night, and I understand, resources are limited, but if we give Terry adequate analgesia overnight, then tomorrow morning we can send him first thing in the morning. And once Terry is able to drink fluid, is happy, pain is under control, then we can get him home.
Do you have any further questions for us at this point?
No, thank you very much for your time, Doctor.
Look, telehealth is a way of saving patients having to hop in the car, drive down, or call an ambulance for something they didn't need to call an ambulance for, to be treated when they could have been treated at home in their local community, in their local hospital, with a nurse there, and you able to prescribe some medication or some fluids that's going to keep them safe and save that drive down. That's what we're aiming to do with it. Typically you'll find after the first couple of consults you'll feel quite comfortable with it, and it's about 1 consult a night we're running at. All the residents have found it's fine, it's actually easy to do, it's not as challenging as you first think.